Okay, so Sam's done really well this session. We obviously ran through a pre-exercise questionnaire with him and he wasn't showing any signs of heart condition, blood pressure or lingering injuries. The only injury that he had was a knee reconstruction that he had done quite some time ago, but he was fine. But we'll just talk a little bit about if he had had some of these conditions, how we would modify the exercise program to suit. So if Sam had had a problem with high blood pressure, we need to be a little bit careful about that. We don't want him doing anything where he's got his feet above his head. We don't want him holding positions for a long period of time, like really holding onto a squat or anything like that. And we don't really want him doing anything where the weight's above his head, so a sort of a standing shoulder press or anything like that, because it can really mess up the blood flow in the body and cause some issues. So we also wouldn't want anything where he's doing a rapid posture change, like a burpee or anything like that. That could really cause some issues. So we'd want to do some nice stationary sedentary exercises, some seated rows and things like that, just to make sure that he's keeping himself safe. Another condition that Sam could have had was a lower back problem or some lower back pain. It's a really common problem across the population, especially when you're training people who are a little bit older or who may have worked outside in a trade for the majority of their life. We need to be really careful with certain exercises of lower back pain. An exercise such as the squat, although you're maintaining a good posture, you need to be careful with that, and that's probably not the greatest exercise for somebody that's suffering from lower back pain. You can still do squats with them, but we use a fit ball against a wall just to keep their back supported, rolling down the wall and back up with that fit ball against it. Also, another common injury for people is the shoulder. The shoulder is a very sensitive joint. It's a large number of muscles join into there and can cause quite some issues for people. So if someone had had a shoulder injury, you also need to be careful about the exercise that you're doing with them. An exercise such as the bench press can be a little bit detrimental to the shoulder. As long as we're only bringing those arms to parallel, that's not so bad. We wouldn't really want to be going really deep. Otherwise that can start to cause some issues. Exercises such as shrugs, lat pull downs and upright rows can also place some unnecessary strain on that shoulder joint. We need to be careful about that as we don't want to cause any extra damage or have that joint slipping actually out of joint. We might modify that to something like an Arnold press or a standing shoulder press, where you're standing there and just raising the weight up in front of you rather than out of the side and placing that extra